welcome to my YouTube channel. This is Nasregina Foundation YouTube channel, the channel where we learn about health issues. We do learn about delivery and labor. And today, guys, I have a special session on IUCD, the intrauterine contraceptive device method, which is a family planning method commonly used by women. And we are going to learn about the general information about the IUCD. We're going also to learn about the effectiveness of this method of family planning, and also how it works, and also some of the side effects or complications that arise during the use of this contraceptive method. So the important fact that today we are going to learn about this contraceptive is the IUCD are coming in two different types. We have the hormonal type and we have the non-hormonal type. And commonly, most people or most women know about the non-hormonal, or would prefer the non-hormonal method because it is commonly and mostly available. So important facts about this IUCD method: it is a small flexible plastic device which is placed into the cervix. The IUCD is a flexible plastic device which is placed through the cervix, and then we have some strings which hangs out. It hangs out on the vaginal walls, and this device is used to prevent pregnancy in breastfeeding mothers, also prevent pregnancy in women who are not ready to carry out a pregnancy. It can also be used by any woman who is sexually active to prevent pregnancy. Also, the effectiveness of this IUCD is that we have the different devices which last up to 10 years. We have the one for 2 years, for 3 years, and we have for 5 years, as well as 10 years. Yes, as I was saying, we have the different devices which last for 3 years. We have this one which lasts for 3 years. We have this one that lasts for 5 years, including this one 5 years, and also 5 years. You can see they are coming in different shapes. This one is the copper T shape. We have this one which is looking like that, and this one also looking like that. Yeah, looking like that. All they look different, but their purpose or effectiveness is as same as each other. So we are talking about the long-lasting device which is working up to 10 years in terms of these devices. Another important fact is about the fertility of a woman after the removal of this IUCD. It is quite easily reversible because it is non-hormonal, so there is no interruption of your hormones in the body. The fertility or the conception rate remains the same immediately after removal of this device in any woman. Another important fact about this IUCD is that it can also be used in HIV women to prevent pregnancy, as you know, because of the condition in HIV, due to we try to limit the number of pregnancies because of the immunity and bodybuilding factors in HIV conditions. And we are talking about also the copper which is involved in these intrauterine devices is the one that is released to kill the sperm, so that there is no fertilization the fertilization taking place. When the sperms are released, they are destroyed by the copper which is secreted by this copper T device. Another fact that you need to know about this is it does not affect your activities during sexual intercourse at any time, because it is comfortable for any woman and also the partner, because of if it is only inserted by an expert or a trained health care provider, then it is well placed and it does not affect your sexual life at any given time. Another good factor about this device is that it can also prevent endometrial cancer. That is very important. We say that it can prevent the endometrial cancer, which is a very, very bad condition when it occurs in the endometrium. That is your uterus. It damages the uterus, and in this case, this device prevents the endometrial cancer by it not having any hormonal side effects. We can also say that this IUCD or device does not prevent the sexually transmitted diseases, or it does not prevent any woman from contracting HIV. So when you use these devices, it's not that you're guaranteed you're not going to get any transmitted diseases. So when you use these devices also, we need to know that we have some of the side effects that we are going to look at that come up about when you're using this device. Some of them that have been raised by the women who have used it is there can be some heavy and prolonged menstrual flow in some cases. There is irregular periods in some cases. In some cases also the women present with low abdominal pains for the first 24 hours, 48 hours, and then analgesics or painkillers can be given to make the woman comfortable when she's adapting to the new family planning method. There are a few examinations that can be done to confirm that this IUCD device is inserted correctly. This is by doing a pelvic examination on this woman who is using this device. It can be done regularly to confirm that the IUCD is well placed and does not have any problem when it is placed inside there. And also we can have regular checkups by the gynae or the doctor who inserted this device. And now let's talk about the Mirena type of IUCD, or the intrauterine contraceptive device, which is hormonal. This is the Mirena type, which is in the market. It is a device like the other ones we have seen, the copper types. The insertion is the same, the way it acts is the same, but this one has the hormonal side effects because it is hormonal, just like the implants or the oral contraceptives. Most commonly, the side effects of this hormonal IUCD is the amenorrhea. This is lack of periods, regular periods, also irregular periods, and we can also have the side effects of gaining weight. Some of the women experience headaches and nausea, and it is a choice that you make to use either the hormonal or the non-hormonal. So as you know or learn about more of these devices, it is good to make your choice because you are already informed and you make the choice as informed. So we are moving on well. If you haven't subscribed, this is Regina, your nurse Regina Foundation. Please subscribe, hit the red button to subscribe, and also turn the button on for you to get any notification of my video whenever I load up my video. Another good factor about this IUCD or family planning method is that it does not affect your lactation if you are breastfeeding mother. It does not interfere in any way on breastfeeding. It does not reduce the amount of milk you produce or affect your baby in any way. So it is the best method that can be used for any woman who is breastfeeding. Also, we are saying that this method should be inserted by an expert. This is a trained personnel to insert these devices, because sometimes if it is not well placed, it can cause uterine perforations, and this is not good because only trained personnel should be able to insert this device. And this is how typically it looks from the outside. This is the T copper, you can see it? You can see it? This is the T which is inserted into the cervix like that, and then this T thing you can see here moves to the tube on one side and the other one to the other tube, and then these strings are the ones we are talking about, which hangs in the vaginal walls, and the strings can be made short so that you're comfortable whenever you're using the toilet, whenever you're having your sexual intercourse with your partner. It feels or leaves him also comfortable, not feeling the strings hanging. So they should be put to a length that it is comfortable for you and the partner. Another good factor is whenever you inserted this IUCD, it is good always to follow your doctor's prescriptions or reviews, so that you are reviewed from time to time to make sure that it is always in place where it was supposed to be placed. If you have any problems with the use of this IUCD, it is a device that is inserted and can be removed any time of your choice. So even if it is meant for 10 years, and like we have seen this one for 10 years, does not mean that it's going to be permanently for 10 years. If you need to conceive or get a baby or get a pregnancy, it can be easily removed so that you can immediately conceive or get pregnant to bear children as you wish as a mother. I was also talking about earlier on about the complications of these devices, which are rare if they're only placed by a trained personnel. We have the uterine perforation, which is perforations inside the uterus when it is not well placed. And also we have the pelvic inflammation diseases, which is commonly when you are using this one. It is a disease that is which causes inflammation in your uterus, and this is also can be addressed whenever you have an inflammation disease in the. When you're using this, it is good to see your doctor so that your doctor can address that. If it feels possible to remove the IUCD for you to get healed first of all, and then proceed with another method, it is okay, or you can stop using the IUCD if it is affecting you in any way. And also we have in some cases where it is not well placed, the device can fall off, that is, it can come out. So this is also not good. Whenever you feel like this device is not well placed like it was in the first place, it is always good to see your doctor for further review. Rarely also we have the IUCD lost. This is the IUCD when it is placed, you find that it's not being able to you can't locate it when you're using the examination or outside the examination. So you need to see a doctor to establish how you're going to be examined and get the IUCD located in the uterus where it has misplaced itself. So guys, we are moving on well. Please subscribe to my YouTube channel. This is your Nurse Regina Foundation channel. Subscribe to my YouTube channel, like my videos, share, and also leave a comment down there for me to know what I need to improve on this channel where we are moving, learning, and also growing with Regina on different health issues, including delivery, breastfeeding, and so many other issues that are health related. So guys, I think it's about that today. Thank you for watching my video. Thank you for staying here until the end of this video. Please subscribe if you haven't subscribed. Also share the video for your friends to subscribe to my YouTube channel. Check you next time when we have another interesting session on these health issues just as today.